Gastric cancer, more commonly known as stomach cancer, is a disease in which cells in the stomach grow uncontrollably, potentially spreading to other parts of the body. It's a serious condition that requires prompt diagnosis and treatment. This video will explore the various aspects of gastric cancer, from its causes to potential preventative measures. The exact cause of gastric cancer isn't always clear, but several risk factors have been identified. Infection with Helicobacter pylori, a common bacteria that can cause stomach ulcers, is a major contributor. Dietary factors also play a role. A diet high in smoked, pickled, and salted foods, and low in fruits and vegetables increases the risk. Other risk factors include chronic gastritis, pernicious anemia, smoking, obesity, a family history of stomach cancer, and previous stomach surgery. Gastric cancer development is often a multi-step process. Chronic inflammation, often triggered by H. pylori infection, can lead to changes in the stomach lining, a condition known as atrophic gastritis. This can then progress to intestinal metaplasia, where the stomach lining is replaced by cells similar to those found in the intestine. Dysplasia, the abnormal growth of cells, may follow, eventually leading to the development of cancerous cells. These cells can then invade the stomach wall and spread to nearby lymph nodes or other organs. Gastric cancer is a global health concern, with varying incidence rates across different regions. It's more prevalent in East Asia, particularly in countries like Japan, Korea, and China. Other regions with higher rates include parts of Eastern Europe and South America. In many Western countries, including the United States, the incidence of gastric cancer has been declining in recent decades, likely due to improvements in diet and food preservation, as well as increased H. pylori screening and treatment. In its early stages, gastric cancer may not cause any noticeable symptoms. As the cancer progresses, common symptoms can include persistent indigestion or heartburn, feeling bloated after eating, loss of appetite, unexplained weight loss, nausea, vomiting as sometimes with blood, stomach pain or discomfort, fatigue, and blood in the stool, which may appear black and tarry. If you experience any of these symptoms, especially if they persist or worsen, it's crucial to seek medical attention. Diagnosing gastric cancer typically involves a combination of tests. A physical exam and medical history are important first steps. An upper endoscopy, where a thin, flexible tube with a camera is inserted down the throat to visualize the stomach lining, is crucial for identifying abnormal areas. Biopsies, the removal of tissue samples for microscopic examination, are taken during the endoscopy to confirm the presence of cancer cells. Imaging tests, such as CT scans, MRI scans, and PET scans, are used to determine the extent of the cancer's spread. Blood tests may also be performed to assess overall health and identify potential tumor markers. Gastric cancers are often classified based on their appearance under a microscope. Adenocarcinoma is the most common type, accounting for the vast majority of cases. It originates from the glandular cells that line the stomach. Other, less common types include lymphoma, gastrointestinal stromal tumors (GSTs), and carcinoid tumors. Within adenocarcinoma, subtypes like intestinal and diffuse types exist, each with different characteristics and patterns of growth. Treatment for gastric cancer depends on several factors, including the stage of the cancer, the patient's overall health, and personal preferences. Surgery is often the primary treatment option, especially for early-stage cancers. This may involve removing a portion of the stomach, partial gastrectomy, or the entire stomach, total gastrectomy. Chemotherapy, using drugs to kill cancer cells, may be administered before or after surgery. Radiation therapy, using high-energy rays to target cancer cells, may also be used. Targeted therapy and immunotherapy, newer approaches that target specific molecules involved in cancer growth or boost the body's immune system, may be used in certain cases. Management also includes supportive care to address symptoms and side effects of treatment. While completely preventing gastric cancer isn't possible, there are several steps you can take to reduce your risk. Maintaining a healthy diet rich in fruits, vegetables, and whole grains and low in smoked, pickled, and salted foods is important. Treating H. pylori infection can significantly lower the risk. Avoiding smoking and limiting alcohol consumption are also recommended. Maintaining a healthy weight and getting regular exercise can further contribute to overall health and reduce cancer risk. The prognosis for gastric cancer varies greatly depending on the stage at diagnosis, the type of cancer, and the patient's overall health. Early detection and treatment are crucial for improving outcomes. Recent research is focused on developing more effective targeted therapies and immunotherapies. Researchers are also exploring new ways to detect gastric cancer earlier, such as through liquid biopsies, which analyze blood samples for signs of cancer. Ongoing clinical trials are investigating novel treatment combinations and strategies to improve survival rates and quality of life for patients with gastric cancer.